Welcome, everyone, and thank you for joining us today. We are thrilled to have you here as we begin our session of our educational webinar series about breast cancer awareness and how DNA testing can benefit in this journey. This session is designed to help you understand valuable insights into early detection, risk analysis, and support for individuals wanting to know more about breast cancer. We are honored to have our speaker, Mrs. Neeraja Reddy Malleda, VP Genetic Counselling at Mapmygenome, and an expert in oncology, adult genetics, and positive psychology. She is also board certified genetic counselor with over 10 years of experience in various genetic fields and co-chair Global Genetic Counselors at NSGC. Today, she will guide us through one of the most pressing concerns in India, the significant rise in breast cancer cases over the past decade. At the end of the session, we'll have a question and answer segment where you can ask Neeraja ma'am any question directly. You can also submit your questions in the question and answer box, which we'll address at the end of the webinar. We also have a surprise offer for all webinar attendees today, so please stay tuned for the offer. Let's get started, ma'am. Over to you.
Thank you, Rituja, and thank you everyone for having me here. It's a pleasure for us to see everyone joining on a Saturday morning. So we're going to talk a little bit about, genetics and its interaction with breast cancer and the risks associated with it. Not just talk about breast cancer associated with females, but also breast cancer risk for males and what are the things that we can do. One is understanding genetics, but also understanding lifestyle, dietary factors, and what are the things that are in our hand that can help us alter some of this risk and detect the cancers early, if at all they are present. So to get you guys started, I'm going to cover a little bit of basic genetics so that we're all on the same page, and then we will talk a little bit about the breast cancer itself and the risk factors related to it. So taking you guys back to high school biology, all of our body is made of trillions of cells. Right? So these are the cells that basically make up all the organs, your skin, your bone, your hair, everything. Within every cell, you have genetic information. And this is placed in the form of something called a chromosome. Chromosomes are tightly packed genetic material. When you open up this chromosome, you get something what we call as the DNA, which is your genetic code, which makes up all of your genetic information. The DNA is what defines who you are and what you will be. A part of the DNA is called a gene. So that is a functional unit of the DNA, which makes a certain protein or tells or gives instructions to our body. So basically, all of this DNA is like a recipe, just like how you would follow a recipe to make a certain dish in your kitchen. All of this genetic information is the recipe for who you are. So can you all guess how many letters we may potentially have that makes up all your genetic information? It's only 4. So there are 4 letters that basically makes up all of your genetic information. So just like in the English alphabet, in English language, you have 26 alphabets. Similar to that, we only have 4 letters in our genetic information, but the permutations and combinations and various potential combinations of this 4 letters, A, T, C, and G, makes up your entire genetic information. So we have more than 3 billion base pairs in every single cell, and that might approximate to more than 25,000 genes and counting, as we're still learning new genes in today's date. 99%, 0.9% of all the genetic information are actually the same amongst all of us. So it's that 0.1% that really makes you who you are. So these 0.1% is basically a letter change or letter differences that we may potentially see. So for example, here the T change to a C, and that might give you a unique trait or a unique finding or some unique feature. Similar to that, we have millions of such SNPs that are present. These are called single nucleotide polymorphisms, which are simple variations. And this is really what makes you who you are. and makes everybody else different from you, right? So we understand that having these genetic risk factors does increase your risk of developing common cancer. So there are different types of cancers, and I will speak about that. But essentially, we want to understand that all of your illnesses are partly caused due to these genetic factors that are pretty common variations present in the general population. The remaining of that are essentially your diet and lifestyle. So even if you were to have good genes and let's say did not have variations in your genetic information, but you had a bad lifestyle, you still put yourself at risk of developing health concerns like cancer. On the other hand, if you did not have appropriate genes or had genes that were high risk, but you did maintain your diet and lifestyle factors, then it reduces your risk of developing such cancers. So essentially, understanding your genetic basis can go a long way for you to alter your health and make sure that we are doing everything right in managing your risk of developing these diseases. So, this is something that I really want you guys to take home today. All cancers are genetic, but not all cancers are hereditary. What it means is cancer in itself is actually a genetic disease, but not all cancers can run in a family. Some of the cancers are acquired. So if you look at the breakdown distribution of all the cancers, we know that about 70 to 80% of cancers are sporadic, meaning these are cancers that are a random event in a family. Nobody else has had a cancer history. There were no other concerns. There were no other, risk factors present. About 5 to 10% of cancers are hereditary. What that means is these are 5 to 10% of cancers that can run in a family because of a certain genetic predisposition that increases your risk of developing the cancer. So most cancers that we see, which is the sporadic 70 to 80% of cancers, are acquired. What that means is aging, for example, is one of the biggest risk factors for you to develop cancer. So these are your cells, the gray ones. So as we grow older, there is some cell damage that can happen. The cells lose their ability to stop dividing. So every cell is programmed to die at a certain point. It will grow for a certain duration, and then genetically, every single cell is programmed to die. But because of these genetic changes that the cell acquires, it will lose the ability to die and it will keep growing. And that is what develops into a cancer. So when the doubling keeps happening and it keeps happening, does not stop, you will develop a tumor because of that. So that is the reason why most of the cancers are acquired or things that can happen to you as we grow older. This is one of the biggest reasons why we see cancer that mostly in the older ages, somewhere around 60 plus, 70 or 80. So there are certain red flags that we identify in a genetic clinic or in your doctor's clinic. There are certain patterns that might raise a red flag that makes us believe that there is more that's going on in this family. So what are those red flags? You may see that in the family, you may see that there are more than one relative with the same type of cancer. So two aunts who have developed breast cancer, or two uncles who have probably developed prostate cancer, or maybe your father and your father's brother who may have developed a colon cancer. Family member with a cancer that is atypical for their gender. So, for example, males developing breast cancer. The risk for males to develop breast cancer is 1 to 2% in the general population. Not common, but it's still present. That is a red flag for us to think that there could be something that is genetic and that we need to screen for. We may find that individuals may have cancers in both organs. So, for example, females developing breast cancers in both the breasts. It's called bilateral breast cancer, or they develop breast cancer in both right and the left breast. Females with ovarian cancer in both breasts, both ovaries. These are all red flags for cancers that might be present. You may also find that there are family members with multiple cancers. So some female who may have developed breast and ovarian cancer, a male who may have developed prostate cancer and pancreatic cancer, or a male who may have developed a colon cancer and a prostate cancer. These are all considered as red flags where we would suspect that there could be a genetic history that may be increasing the risk of developing the cancer. So when you look at breast cancer, and these are like the latest statistics from 2020, to 23 from India, we see that in India we have a much higher prevalence. 14% of all the cancers that happens in Indian women are actually breast cancer. Collectively, Southeast Asia, which is India and China, particularly account for almost 1/3 of all the global breast cancer cases. And in fact, the mortality is also higher in the Indian population. In fact, it's sadly much higher as compared to the mortality, maternal mortality, which says a lot about the detection as well as the treatment of the cancer. If you look at just the mortality, which is the risk of somebody losing their life because of breast cancer, we are at about 34%, while worldwide the mortality is about 30%. And in fact, in the United States and in Europe, the mortality is much less. So this calls for early detection. It calls for being aware about your risk and being able to take steps towards it so that the detection of cancers happen early, where it is treatable and you can get back to a normalcy in life very quickly. So what are the red flags for breast cancer? So there are some red flags that are non-genetic as well, right? So until now, I spoke to you about the genetic red flags, which are of two types. One, those are common red flags, common genetic variations that might be present. The second red flag is the genetic factor that can be passed on from one generation to the other, which only happens in about 5 to 10% of the family. But there are many non-genetic risk factors also for cancer. And in fact, we have been seeing that the incidence of breast cancer has been increasing. One, due to the involvement of more exposure to these non-genetic risk factors. Second, due to better detection. So, of course, the better detection, the higher incidence, because you pick up more breast cancers when you can detect them better. So, some of the non-genetic risk factors that we see include alcohol consumption, smoking history, having a risk for obesity, which is a major concern now in urban Indian women, genetics, which is one of them. Pregnancy can actually sometimes does increase your risk for breast cancer. Radiation exposure is not very common, but definitely present for many of us. Diabetes, aging in itself, hormone exposure. These are all risk factors for developing breast cancer. But there are now some risk factors that can help you reduce your risk of developing these, right? So what are those? Physical activity. Moderate physical exercise at least 3 to 4 times a week for 30 minutes can go a very long way in helping you reduce your risk of developing cancers, especially breast cancer. Controlling your weight. So a lot of the urban Indian women are either overweight or obese. And a lot of this has to do with our lifestyle, our diet. It's also put us at risk for increased prevalence of PCOD and PCOS, which are becoming common concerns, leading to infertility in many women. Avoidance of alcohol, avoidance of tobacco and smoking, and prolonged breastfeeding. These are all very important factors that can help us reduce our risk of developing breast cancer. Luckily for us in India, we do have good maternal leave policies, which allows most of the Indian women to be at home with their child for at least 6 months, which is mandated by the government, giving us an extra advantage in making sure that we are able to breastfeed our kids. And that definitely reduces your risk of developing cancers going forward. What about men, though? So, like I said, men do have a risk of developing breast cancer. It is unspoken, and most of the men do not recognize that they need to be self aware about this. So, breast cancer in men are rare, but it is definitely on the rise. Like I said, 1 to 2% of the population is at risk of developing breast cancer. But the detection of breast cancer in men is fairly easy as compared to the detection of breast cancer in female for obvious reasons because the amount of tissue is lesser. Family history plays a very important role here. Like I said, males with breast cancer is a direct recommendation for genetic testing. So if you or any of your family members or any of your friends are aware of any males in your family with breast cancer, please recommend them to meet with a genetic counselor for genetic testing. Mammograms are not just for women. Men are also recommended mammograms. It is something that's important. High levels of estrogen does increase risk for breast cancers in males, and this can also happen due to your lifestyle changes or sometimes even hormonal treatments that may be required. So symptoms that you need to be aware about. For females, most of the times you may recognize a lump You may recognize nipple retraction, which is inward curving of your nipple, or any swelling that's basically present under your armpit or around your breast tissue. It is strongly recommended for all women post 20 to do a self breast examination once every month when your period begins. And you need to look for any changes in or any discoloration, any lumps, any growth, any swelling that might be present around your breast tissue, under your armpits. Look for any discharge in your nipple or any changes in terms of discoloration or dimpling that might be present. For males, redness in your breast, any lump that you seem to be developing, any nipple discharge, or again, dimpling around your breast, or the nipple turning inward are big signs that you need to go to a doctor immediately. Many times, men may ignore these symptoms, which is not recommended. If you notice that there are any, especially discoloration or any sort of changes in the skin around your breast, then you please recommend this, mention this to your doctor for a self-breast examination, and then get a mammogram done so that they can look for any changes internally. So, like I said before, cancer is a multifactorial disease. It is a complex condition. Genetics alone does not always put you at risk. It's like a jigsaw puzzle where genes play one part of that, but you need to put the rest of the things in picture and put them together for you to even develop the symptoms. That includes your family history, your lifestyle, and your environment. So while you can't change your family history, neither can you change your genes. Being aware of both of these goes a long way. It's like a tool in your toolkit that can help you alter your lifestyle as well as your environment. So unlocking the power of your DNA can help you do both of these. So there are some tests, for example, genome pathy, which is a test that looks for these SNPs or single nucleotide polymorphism, which are those simple variations that makes you who you are. But these variations can potentially help you predict your risk of developing certain types of cancers. So making sure that we are aware in the general population that there are some people who may have certain variation that puts them under the high risk category, versus there are some people who will remain in the normal population risk category. Early intervention for people who are in the high risk categories and changing their diet and lifestyle can go a long way in prolonging or preventing the disease itself. So the benefits of doing these tests is that it can help you understand your lifestyle risks, your cardiovascular risk, respiratory, diabetic, immunological concerns, certain kinds of medications, and cancer risk. A lot of the times, cancer risk is not alone or isolated, but it can also come from risks for your lifestyle or sometimes even your endocrinology, which is your diabetes, hormonal exposure, and as well as your cardiovascular. So, understanding these genetic risk factors that are increasing our risk to develop chronic illnesses in our lifetime can help you prevent some of the symptoms or prolong the onset of the symptoms. So, this can help you personalize your overall health. Understanding these concerns can help you improve your quality of life. It can help you identify the best treatment, mitigate some of these risks by altering your dietary and lifestyle parameters as well as your physical exercise. But overall, mainly, it helps you reduce your healthcare costs, which is something that's priority for most of us. So those are about your common genetic factors that we may all have. But what about the family members where there is a strong family history or you identify a red flag? Two most common genes, BRCA1 and BRCA2. These are very much talked about thanks to Angelina Jolie, who came out in the newspaper New York Times back in 2014 and talked about her story about being tested positive for a BRCA1 mutation. She underwent a preventative mastectomy, which is the removal of the breast tissue, and also had her ovary subsequently removed. There is a strong family history of breast cancer and ovarian cancer in her family. That's something that puts these two genes in the spotlight for the general population. BRCA1 and 2 are present in about 18% of women who have ovarian cancer and in about 5 to 10% of women who have breast cancer, especially early onset. Most of the families who have BRCA1 and 2 tend to have breast cancers as an early diagnosis, sometimes even in their 30s and 40s. They may see ovarian cancer risk. They may also see prostate and pancreatic cancer risk in the males. And in BRCA2 specifically, they may see a risk for male breast cancer. Having these genetic changes increases your risk of developing breast cancer to about 45 to 65% in your entire lifetime by the time you're 70. So there are some interventions in terms of screening, sometimes surgery, and also medication that may be recommended for women who test positive for these BRCA1 and 2 genes. It's extremely important to remember that you come in for a genetic counseling appointment before you do any sort of genetic testing for hereditary cancer syndrome. The reason for this is because it can have implications not just on you, but also on your overall health, your screening, your family members, like your kids, as well as your siblings and parents. So make an informed decision by understanding the risks, the benefits, the pros and cons of doing such testing and how it impacts you. And sometimes identifying the right time for testing before you go forward. BRCA1 and 2 are just the two most common genes. There are many, many such other conditions. This is an example of a family wherein we've identified almost two generations with cancers, including pancreatic, breast, colon, as well as a bone cancer in a child. All of these cancers can sometimes indicate the presence of a hereditary cancer syndrome in the family. This particular family had a condition called Leaf-Romany syndrome, which is caused due to a gene in a gene called TP53, which is a very common cancer. So essentially, what we want to do is to personalize your screening, your interventions, as well as any genetic testing that is done for you. We strongly recommend genetic counseling that can help you personalize your genomic information and the management plan. At Mapmygenome, we have a set of board certified genetic counselors who have experience in oncology, in personalized genomics, and adult genetics who can help you overall understand your personal history, lifestyle factors, family history, and then we develop a plan for you to undergo genetic testing and then walk you through the information that we got to help you make an actionable plan that's personalized to you. So interventions can happen at various levels. One is understanding what nutritional factors are important, what are your exposures that might be at risk. In addition to that, what lifestyle factors should we make in order to reduce the risk of reducing these cancers over a period of time. The process is pretty easy. It is a sample collection, usually a swab or sometimes blood. It takes about 3 to 4 weeks for these reports to be ready. So the diagnostic genetic testing, which is done for genes like BRCA1 and 2, they involve different types of genetic testing. Those take about 3 to 4 weeks. The common variations that are looked at in tests like genome-pathy, they can come back much faster in about 2 weeks' time. So just a quick overview on Mapmygenome. We're a genomics company with about 23 years of experience overall in genetics and genomics. And we have a strong team of biotechnologists as well as bioinformaticians and genetic counselors. And our focus is on prevention as well as healthcare to make sure that we are able to improve healthy daily habits of individuals. And there are many other kinds of genetic testing. These are the preventative offerings. We also have a lot of diagnostic genetic testing that's done when we identify red flags or has been recommended for testing by a doctor. So I want to end by saying that being forewarned is being forearmed, and that's what will keep us healthy and would make sure that we are able to live long, but with health and with prosperity. Thank you. And this is the code that Rituja had earlier mentioned. Rituja, you can speak a few words about it.
Ma'am, before going to this slide, I would like to firstly thank you, Neeraja ma'am, for enlightening us on so many important aspects of breast cancer today. Your insights are truly valuable. I would like to have this forum open now for the question and answers if our attendees have something that they want to, ask you or any question in their mind. So if anyone wants to ask any question, feel free to unmute yourself and ask, or you can even raise your hand if you don't have the rights to speak. Just check. And you can even type your questions in the question and answer box, which will be available on your settings in Zoom meeting. So feel free to ask any questions to Neeraja ma'am. It's a wonderful opportunity to get those doubts out there so that she can address them for us. Anyone has any questions? You can also type your questions in the question and answer section. Yeah, there is one. Ma'am?
In order to get generic or medical examination done, see, for general population where there are no red flags, or for every woman, we actually recommend getting a mammography done once every year after you are 40 years of age. Between the ages of 20 to 40, it's recommended that you do a self-risk examination once every month. Along with that, you can have your doctor do a clinical breast examination or gynecologist once every 6 months. This is the standard recommendation unless you pick up any risk factors that you think you need your doctor to look at. And for Indian women, given that our breast tissues are more fibrous and less fatty, sometimes mammography is not the best test. So your doctors might even recommend doing a sonography instead of a mammography. So that decision will be made by your doctor depending on what they think is the concern.
Thank you so much, Neeraja ma'am, for addressing that question. We have one more question in the chat box, ma'am.
So cancers can see the fat tissue it does not multiply as much, but muscles do, and it's not necessary that it's the muscle that is at risk more than the fat tissue. We do see cancers in fatty tissues as well, but most of the cancers will be identified either in cells that are epithelial, meaning cells that will develop into a particular tissue, as well as it, and then we see that there can be, fat that is surrounding it. So that's something we see. Um, so for cancers, it depends on whom you should consult for your routine screening with no other risk factors and no concerns. Your routine mammography can be done at your gynecologist office or your OBGYN office. They would do your routine mammography and they may recommend you to come back with a report and get an examination done. If there are any suspicions of any concerns, then the doctor will then refer you to an oncologist or a radiologist for further follow-up. So lowering chances of breast cancer, like I said, for most of us, it's important that we focus on exercise, we focus on weight management, and we focus on screening as well as reducing exposure to alcohol and smoking. In the past, they said that moderate amounts of alcohol did not have a risk factor for cancers. Now, new studies are reporting that any amount of alcohol is actually a risk factor. So complete alcohol cessation is what's being recommended now. Eating healthy plays a very important role. So for many women, studies have shown that it's not just having, let's say that there is a woman who is healthy, appropriate weight, but does not exercise. So sedentary lifestyle is also a risk factor for developing cancer. It's not just the weight management, but also an active, moderate lifestyle. It doesn't mean that you need to go hit a gym for like every 1 hour every single day. Even moderate exercises, which is 20 to 30 minutes, 4 to 5 times a week, is good enough, right? But you want to make sure that you get some form of exercise, whether it's walking, running, jogging, dancing, whatever you like. But weight management alone is not enough. We need to get our bodies moving, right? So that's important. So DNA test, if you do, yes, both of these are one-time tests, but both of these, the interpretation of that depends on your family history and your own history. So how we interpret that can potentially change over a period of time, but the genetic variants are things that you're born with will always be there. There are tests that are done for individuals who are diagnosed with cancer, which are different. That is done within the cancer tissue. Those are completely different.
Ma'am, there's one question that has come in question and answer, window. Shruti ma'am is there as an here with us, and she's asked us that how does breast cancer treatment differ from women of various age groups?
Yes, so it does differ between different kinds of age groups, is because it can, especially for women who are, let's say, see, it depends on the type of cancer, the stage of diagnosis of the cancer. Example, if they have an underlying BRCA1 or 2 mutations, now there are personalized therapies that are available. There are personalized chemotherapies that are working much better in people who are carriers of BRCA mutation as compared to people who are not a carrier. If it's a woman who is young, who's diagnosed with breast cancer, of course, the approach is slightly more, they want to be sure that you're reducing mortality or making sure that you're giving a good chance for complete recovery and no recurrence. But that can also mean that you might want to consider, if the treatment is aggressive and it requires full removal of the breast tissue, then options of reconstruction options. There are now so many options on reconstruction surgeries that are available. But then for a woman who is probably older, they may not as much as consider more so much more about the reconstruction. But again, it's a personal choice. Everyone feels
Yes.
differently about their body image, and that needs to be a decision that is discussed in detail with their doctor. But the treatment itself really differs based on the age of diagnosis, the type of diagnosis, potential genetic changes associated with it. Because even within chemotherapies, there are different types of chemotherapies. Now there are new age chemotherapies which are more effective and less toxic. So there are many options that are now available.
Okay. Thank you so much, ma'am, for the answer. We have one more question, ma'am, in the question and answer window. The question is, what pathological tests for male or female can be helpful in detection of cancer?
Just the screening. So imaging study is the most important way of detecting a cancer and of course symptoms. There are no blood tumor markers or anything that we can do preventatively. That's why we put so much emphasis on the self-breast examination for both males and females. um, there is still a lot of taboo around cancers, right? Let's accept that. There is still a lot of taboo around accepting breast cancer, more so in males as compared to females. At least now females are more, comfortable saying, okay, I have a cyst or I may have to go see a doctor. Males, not yet. There's very few males who, in fact, there was a movie that came out called Pink and Blue. I don't know if anybody has, can find access to it. I would strongly recommend watching it. It's called Pink and Blue. It talks specifically about males diagnosed with breast cancer, and there is this part of the movie where the male goes for a mammography because he picked up a lump, and he jokes about how the screening form asks him when was his last menstrual cycle, and he's like, "What? This is not for me." But that's how we are. Unfortunately, even the medical community does not really have anything tailored for males with breast cancer, right? And we need to accept this fact. So there are no screening tests as such. I would strongly emphasize please do a self-breast examination, both for males and females. Um, and if you find that there is something abnormal, please report to your doctor as soon as possible. The more you wait, and if it really is a concern, then we are just delaying the treatment, right? And it increases more complications for all of us. With respect to the type of mammography or screening that is essentially done, we would recommend doing a mammography first. But again, like I said, sometimes mammography is not the best screening method if you have to pick up something that in a tissue that's very fibrous. So in that sense, they may do an ultrasound. They may even recommend an MRI if required.
Thank you so much, ma'am, for addressing that question as well. Ma'am, we have one more question, two more questions in the chat window as well. Like one of the questions is, what is the acceptable age to get the DNA test? How early should one take it? Should I get a test also for my 14-year-old daughter?
No, these are all adult onset conditions. We strongly recommend that somebody should be 18 years and plus before they get genetic testing. And for anybody, in fact, for genes like BRCA1 and 2, we in fact recommend waiting until the 2023. Uh, Ideally, 23 is because we would only start screening at 24. So there are a lot of implications on knowing certain information before that when you can't do anything about it. But all of this is also to do with the family history. So if there is a strong family history, I would strongly suggest that come and meet with us so that we can discuss it and appropriately offer the genetic testing. There are some types of cancers that are early onset, like the family I showed you with the Leaf-Romanese syndrome. There are early onset cancers. Those can be detected even in a child, but that's not a breast cancer. That can be other forms of cancer. So whenever, if you found that you were one of the person who had a red flag that can potentially put you at risk of having a hereditary form of cancer, speak to a genetic counselor. They will help you identify which tests, who is the right person. We don't recommend directly testing someone who's unaffected and healthy. We ideally want to test somebody who has the cancer diagnosis first. So that is also an important decision to do. So those are all, things that we would want to discuss before any further testing is being determined.
Thank you, ma'am. One question more. It's there in the chat.
So mental health, stress levels, yes, there's no way for us to measure it, unfortunately. I've asked myself this question many times, but I don't think we all have a good answer to it. Only if stress levels could be measured, I think things would be very different in this world. We don't yet have that. But there is anecdotally and papers that strongly suggest that yes, stress levels make a huge risk factor for developing any type of cancer, not just breast cancer. And anecdotally, I've had many women who've said, I've undergone grief, I've undergone stress, and a year or two later, they have had a diagnosis of cancer. We do know that stress affects your body physiologically, and that is an important factor. So it is a good point that you raise is that as much as you're taking care of your physical health, you have to focus on your mental health as well, right? So meditative practices, mindfulness, taking off some time to maybe just having a relaxing breakfast. That are important steps that we all should do, men or women, to make sure that we are able to take care of ourselves.
There's one more question. Thank you for the answer. And the question is that latest news of Russia cancer vaccine. Any views on it? Any suggestions?
Depends on what the cancer is talking about. I've not seen this paper yet. There are certain types of cancers, for example, cervical cancer. And again, thank you for bringing this up. Really important topic is that cervical cancers do have vaccines that are available. Indian government has been pushing for getting these vaccines. All women, all girls, after their teenagers, when they are 14 plus, please speak to your doctors about getting your girls vaccinated for these cervical cancers. They are completely preventable. Okay, not all of them, but at least 16 strains are preventable. These are cancers that we get because of an infection of a certain type of a virus for which we have vaccines. Cervical cancer is one of the leading causes of death in in women in India, and we can avoid many of those. So just like you get your mammography done for every woman after you're 30, it is recommended to get pap smears at least once in 2 years as a regular screening test. Along with that, these vaccines are really important. Please make sure that if you haven't gotten it yourself, speak to your gynecologist. Um, but the most effective age is to get it when they are after 14 years of age. So speak to your doctors about it. Please make sure that you had a conversation and your girls can get those vaccines. For the breast cancer as such, I have not seen any vaccine and I'm not aware of the Russian vaccine.
Thanks so
Uh,
much. One more question. Ma'am, any upper age recommendation for these tests related to breast cancer?
So, upper age as such, see, most of the cancer risks are present until somebody is 60 to 70. Okay, so
Okay.
those are the ages where we tend to see risk for cancers developing. Um, Post 65, 70, the risk of cancer is fairly low. So, it may not be something that very much affects their health or risk, but we would still continue doing a breast examination depending again on the family history. A lot of this is dependent on your own personal history and family history. But generally, it's like a curve. Okay, so as you are in your 30s and 40s, risk is the highest. 50s also risk is higher. Post 60, your risk starts to go down, right? So 60s to 70, risk will start reducing slowly, and after that, they may not be very aggressive on the screening either. Okay, it's not uncommon for you to see women developing breast cancers in the 70s, in the 80s. So we can't ignore that either, right? So it has to be a balance that is present. But in terms of genetic testing, there can be various reasons for testing, right? If that woman was diagnosed with cancer in her 40s and at that point, obviously, breast cancer testing was not available. Now, if the genetic testing is available, I'd strongly recommend it. So this decision depends on why are we doing the testing, what information are we going to get out of it, and how does it impact, right? So all of that are questions that we need to discuss before we make a decision. Um,
Hmm.
there's another question, I think, on the fertility, right? So breast cancer treatment, yes, can affect fertility, but now with the new age therapies, doctors are very much aware about this and they are making all precautions. It does not mean that you can't have a child after having breast cancer treatment. In fact, there are women who get diagnosed with cancers during pregnancy. Chemotherapy is absolutely safe during pregnancy. There are women who get chemotherapy while they are pregnant and give birth to a normal, healthy child, right? So there are risks associated with certain types of treatments, but doctors are aware about it. If there are genes like BRCA1 and 2, and there is a risk for ovarian cancers, they may talk to you about freezing your eggs. Or if there is an immediate planning for a family, they may even postpone certain types of surgeries and treatments until that decision is completed. Cancer screening is proactive, yes. And it is a safe approach. See, depends. So most of the cancer screening, like mammography and your, routine breast examination, WHO has been advocating this for years together for everyone. Of course, they are safe. Mammography has radiation, but under a certain limit, which is considered absolutely safe. Generally, you get this done once every year. Sonography does not even have radiation exposure, so they are very safe. There are no concerns there. All of us have had x-rays through multiple times through our life, right? And there's no concerns because of that. It is absolutely life-saving. I would strongly recommend to make sure that all of us are proactive about our screening and proactive about self-awareness. And of course, making sure that I think a lot of the incidents of cancers and cardiovascular risks, like many doctors have reported this, and there have been many articles in the papers, is because of our lifestyle getting worse day by day. One is stress, second is lifestyle, third is bad eating habits. And I think all of us have to really reflect on all these factors.
I think we have addressed almost all of the questions that were asked or put forth in the forum today. I'd like to thank you, Neeraja ma'am, again for your insightful presentation.
So much
And
well.
a big thank you to all our audience for joining our webinar today. As a special thank you to all the attendees, we are pleased to offer a 10% discount on our Genome Health Test Kit that you can avail on our website. All the details are available on the slide, as well as we'll be putting them in the chat as well. So please feel free if you have any questions related to this particular test kit, feel free to ask them on the link provided on the slide. Today's webinar was a part of an ongoing educational webinar series, which will continue with a new session soon. To stay updated on the upcoming webinars, we encourage you to join our health series by iMeUsWe community on the iMeUsWe app. Thank you again for being a part of today's session. Thank you, Neeraja ma'am, for the insights and the support you have given us by coming to our platform and addressing all our questions here. We really, really are thankful to you.
You're,
And we
and I want to say my thanks to all the people who are here. You guys asked very good questions, so thank you for that. Thank you for interacting with us.
and thank you so much for all the attendees. We look forward to seeing you in our future webinars. Have a wonderful day, everyone.
Thanks. Have a good weekend. Thanks, Rituja.
Thank you, ma'am. Thank you, everyone.